Good afternoon to everyone. My name is Nirashini. I'm the team leader for this program, and our program name is Let's Talk About the Awareness of COVID-19. Here, I would like to give a simple introduction about the COVID-19. What is COVID-19 stands for? Okay, let me tell you. CO stands for Corona, VI stands for virus, and D for disease. So COVID-19 stands for coronavirus disease. The first case was identified in Wuhan, China on December 2019. The disease has since spread the whole world and now it's leading as an ongoing pandemic. Other than that, the coronavirus are a family of viruses that can cause illness such as respiratory disease or gastrointestinal disease. Respiratory disease can range from common cold to more severe disease such as Middle East respiratory syndrome and severe acute respiratory syndrome. Coronavirus are single-stranded RNA virus about 120 nanometers in diameter. They are susceptible to mutation and recombination, therefore it's highly diverse. COVID-19 mostly affected the people who is 60 years old and above and the people who is suffering with other health conditions such as lung disease, heart disease, diabetes and immune system disease. Additionally, as a public, we should be aware from this COVID-19. It's really dangerous for human body health. We also must follow some precautionary steps that stated by the government for our safety. Not only that, we also must stay hygiene for ourselves. It's really beneficial for us. Okay, that's all from me. Thank you. Stay home and stay safe.
Kartika. I'm here to talk about the symptoms of COVID-19. Well, it's quite serious and sad because millions of people died all over the world. So it's quite sad, right? And even though the vaccines were invented and being invented into a new advanced level in the future, but still we are hearing new clusters are being found all over the world. So everyone, please stay safe and maintain social distance. Back to the topic, different people are infected in different ways. You can't specifically say everyone will have these kind of symptoms because each and everyone's immune systems are different and you will react differently to the disease. So most people who are infected will develop mild to moderate illness and recover without hospitalization. Some have to because their immune systems are weak to oppose the disease. Well, the common symptoms are fever, dry cough, and tiredness. Second point, you can say less common or rare symptoms, which like pains all over your body, sore throat, diarrhea, nausea or vomiting, conjunctivitis, or you can say infection of eye, headache might be mild or severe, loss of taste or smell, or either both can be appear, rashes on your skins, discolorization of your fingers or toes, both may be, means your fingertips and your toes will be pale, the skin will be pale, like there's no blood circulation over there. By the third point, serious symptoms, which are like difficulty in breathing, shortness of breath, chest pain or pressure kind of sensation in the chest area, loss of speech or movement, because your muscles will be like unable to move due to the infections of the virus. That's all, guys. So please take care, please stay safe and maintain social distance. Thank you.
Hi everyone, good afternoon. I'm Ravita here from batch 32 pharmacy. So we were given a task to talk about precautions taken during COVID-19. As everyone knows this far that the pandemic COVID-19 has really hit us bad. Many has been affected and many have even led to death. Due to this rise of number in COVID-19, has a responsible citizen of our nation, especially Malaysia, our government has implemented precaution steps to be taken during this pandemic COVID-19. For example, the precaution steps that have been taken for this COVID-19 pandemic is you gotta maintain at least a 1 meter distance between yourself and others. This is to reduce the risk of infection, especially when they cough, sneeze, or speak. If you maintain a great distance between you and your outdoors, and others, there will be a better to avoid the spreadness. Secondly, wearing a mask has been a normal part of being, as it has been the most important thing currently. Wearing a mask is a normal part of being around other people. The appropriate use of a mask is you got to store and clean or dispose the mask after using it. There are some basic ways on how to wear a mask. For example, you got to clean your hands before you put your mask on, and after you put your mask on, you have to take it out, you have to wash your hands. Make sure that the mask, when you throw this, make sure when the mask, when you throw, your hands do not touch your nose, mouth, and your chin, and cover your nose, your mouth, and chin when you use the mask. Thirdly, do not use mask with valves because it will cause some issues. Okay. Fourthly, do not forget the basics of hygiene. As example, you got to regularly and truly clean your hands with an alcohol-based swab, which is known as hand sanitizer, or wash them with soap with water. This eliminates germs, including viruses that may be in our hands. The last precaution steps are: avoid touching your eyes, nose, and mouth. Your hands might touch surface that can be contaminated with virus, so avoid touching your nose, your eyes, your mouth, because these may occur and infect your body straight. And clean and disinfect surface frequently, especially those who are regularly touched, such as door handles and phone screens and many others. So as the risk of COVID-19 is increasing, we got to make sure that we are safe and sound. Take care, stay safe, stay healthy.
Hi everyone, my name is Shamini. Today I would like to share some information about treatment for COVID-19. To make it more clear, I have divided it into two phases, which is before found vaccine and after found vaccine. Let's start with before found vaccine. Before found vaccine, if someone has been exposed to someone who has COVID-19, they have to call the healthcare provider to make sure when to get a test of COVID-19. If test is not available, they should stay at home for 14 days and wash your hand frequently, wear a medical mask, and distance yourself from others about 1 meter. Monitor yourself for 14 days and call your healthcare provider if you have any of these danger signs, such as difficulty in breathing, confusion, loss of speech, and chest pain. Next, there is some medical treatments before found vaccine. First treatment is optimal supportive care, includes oxygen for severely ill patients. Next treatment is respiratory support, such as ventilation for patients who are critically ill. Now, let's talk about the vaccine. The Pfizer vaccine is a vaccine that aims to protect against the COVID-19. Brand name of the vaccine is Community, and generic name of the vaccine is Tocinameron. Type of vaccine is RNA, and method of administration is intramuscular. The vaccine has an efficacy rate of 95% to prevent COVID-19. Now, let's talk about how the vaccine works. The vaccine uses messenger RNA, generic material that our cells read to make protein. To protect the vaccine, Pfizer wrapped the mRNA with the oily bubbles made up of lipid nanoparticles. After mRNA moves into our body, the mRNA has been destroyed by our cells. After the mRNA dies, the information is taken up by our immune cell, which is called as antigen presenting. The antigen presenting cell activates another immune cell, which is called as killer T cell. And finally, the killer T cells is the one who kill the coronavirus cells.
I'd like to talk about the conclusion of how COVID-19 spreads. Expert believes that this virus, which is COVID-19, spreads mainly from person to person. So, how does this spread? The first will be through the droplets, or they call it aerosols. When an infected person coughs, sneeze or talk, droplets or tiny particles called aerosols carry the virus into the air from their nose or mouth. Anyone who is within 6 feet of the infected person can breathe it into their lungs. The second one will be airborne transmission. Research shows that the virus can live in the air up to 3 hours. If can get into our lungs, if someone who has breathes out, the person who had infected breathes out, and you breathe in the air, that's how you get infected, through the airborne. So the third one will be through the surface transmission. Another way to catch the new COVID-19 virus is when you touch surfaces that someone who has the virus and coughed or sneezed on the surface or touched on the surface. You may touch the surface that contaminated and then touch your nose, mouth or eyes. That's how you get COVID-19. The virus can live on the surface like plastic and stainless steel for up to 2 to 3 days. To stop it, we should clean and disinfect the surface before we use. So the last one will be through the pets, for example cats, dogs and all. So COVID-19 also will infect pets. A few pets have tested positive for COVID-19. Not all of these animals has signs of illness, but some have had mild symptoms, but we don't know. The animals may have caught the virus from close contact with humans who were infected. So how can we prevent this COVID-19 to be spread? So first of all, clean your hands often. Use soap and water or an alcohol-based hand rub, which is sanitizer. Maintain a safe distance from anyone who is coughing or sneezing. Wear a mask. Have a cough, fever, difficulty in breathing, immediately go to the nearest hospital to check if you were infected, so that we know how to prevent and not to spread to others who is healthy. Thank you.
Justin had an awesome weekend. Now that it's Monday morning, he's taking the good vibes into the office and surprising his work pals with donuts. Problem is, tasty treats aren't the only thing he's about to share. Justin doesn't know it, but he picked up a germ at a concert last week. Now he's sprinkled his donut box, his hands, and the office door with those germs. In real time, as Justin says good morning to John, and Ashley grabs her favorite Boston cream, those germs have hitched a ride onto two new hosts. With a rub of the eyes and a gulp, they're through the human front door and ready to get down to the business of making people sick. A little later, George comes with the mail. Justin offers him a donut, and with a tickle in his throat, Justin says bye to George and leaves more germs behind. George starts making his deliveries, and as you can see, there's no return to sender on Justin's leave behind. All it takes is a touch of the germy mail, and then a touch of the mouth, nose, or eyes for a person to become infected. When it's time to call it a day, Ashley brings the infection onto the train. She hasn't washed her hands in hours. The germs covering them make a pit stop on the grab bar, before finding a home on some new hands. A few cars over, Justin is coughing again. In these tight quarters, that's bad news. He and his fellow passengers get off the train and head to their homes. The spread continues. But what if Justin's morning had gone more like this? A sneeze into the elbow, and then some hand sanitizer to be safe. A cough into a tissue, and a good job throwing it away and washing hands. Coworkers don't touch their eyes, noses, or mouths, no matter what. By following those steps, Justin's germs could have stayed away and slowed the pace of the spread.